We're going to go over the modified bowel cleanse, which we spoke about in case number 1, simple hyperchlorhydria. We use that to help this woman get better and improve the Obermeyer's test. And it's something you're going to use over and over and over and over. I've used it literally tens of thousands of times over a 3-decade period. Dr. Michael Sesson developed this bowel cleanse. It was a full bowel cleanse over 50 years ago, before anybody ever heard of dysbiosis and leaky gut. And I modified it to make it simple and easy and effective for the patients, and used it many, 3 decades. So the method works well. It reduced an Obermeyer's test, Innikin test, which talked about in the first video. And within a week, it eliminates many of your food sensitivities, and over a 2 or 3 week period. And this is one way to eliminate food allergies also. But you'd want to check your IgG blood allergy test to make sure, especially if you had an autoimmune condition. It should be part of any gastrointestinal allergy, autoimmune, or any chronic inflammation or chronic infection in the gut. There's no pain, there's no discomfort. Always perform the gastro test and Innikin test before you place a patient on the modified bowel cleanse. You need to know this information. The bowel cleanse is optimized if you know the stomach pH and dysbiosis level and treat it simultaneously together. You need to determine the following. What's the pH of the stomach? Use a gastro test. Amylase and lipase are in a normal range. Blood work. Is a cut blood stool negative or positive? This is very important. You need to know if they have a cut blood stool. Don't forget to request your records, especially if they've been to a gastroenterologist and had scopes. Is a guaiac test with a gastro test negative or positive? We'll make a video about this. You can call the company and we can explain how to do the guaiac test on the gastro test to see if there's blood in the stomach or the esophagus. What does the Innikin test show? 1 through 4 levels or other comprehensive GI testing. You need to know something about what's going on. Is it bacterial, viral, fungal, parasite? You can get a lot of this from your blood work. Are there intrinsic or extrinsic factors that you determine that? Is it inflammatory or non-inflammatory? Very, very important to know this when you start selecting herbs to use with this. Request from other doctors, and very important, is it a disease or condition that requires further evaluation by a specialist? If you find something that's a red flag, get that cleared up before you start doing any of this work. Modified bowel cleanse. I'm going to go through it real quick and then we'll demonstrate how it's done. Place 1 scoop of vitamin C buffered powder and 1 tablespoon of evac powder, which is a psyllium seed, that's a commercial name. 30 drops of liquid chlorophyll and 1 teaspoon of biodophilus or acidophilus, your choice according to what you want to use with the patient. Mix this combination in about 3 ounces of reverse osmosis. You can cut it in half with juice. I prefer reverse osmosis. Mix it and rapidly and drink it in 10 seconds or less, immediately before it bulks up in a glass. I've found that the capsules of these things don't work very well as a powder. They cause stomach cramping and they bulk up. The key here is to mix it quickly before it turns to a gel. Then immediately drink 6 to 8 ounces of oral water. Take the prescribed medications or herbals at this time. Dose as your prescription as a physician. Evac's a special sterilized psyllium seed mix. You can email or call a company, GastroTest, for sources. These are comments that I'm going to make about doing this for 30 years and thousands of times. The medicines are my recommendations and they come from real practice. Herbs produce the best results that I've had. Occasionally I've had to have antibiotic therapy, and if you're not an expert in that area, then you need to have somebody work with you. Find good products and use them with objective testing and not symptoms or muscle testing only. You need to find out what works and what doesn't work. Don't get too complicated. It makes no sense to reinvent the wheel. Find doctors with a lot of experience and success, and then when you get better at it, you can improve it. Herbal medicine is as much a science as an art. So be flexible. Actually, medicine all over has that. Be flexible and experiment. You're not going to hurt anybody with herbal medicine unless you really do something that you shouldn't be doing, and we're not going to do that. Do your test, Find out if it works. Don't guess. Prove your treatments. And your patient's life may be at stake, especially when you start doing the occult blood stools and all that. You want to make sure this patient is a good candidate for nutritional therapy and they don't have something really serious going on like colon cancer or some other serious condition. Make sure you get that all cleared. Herbal medicine using generalizations, powdered capsules work the best. Tinctures, if you're going to use them, and I'll give you a little bit of tincture at the end. It's kind of a neat little formula for spasm. They need to be dosed separate from the modified bowel cleanse. When you determine what's inflammatory and non-inflammatory, dose your herbals accordingly. You want to use mucilaginous herbal types of products for inflammatory and your non-inflammatory, and it's bacterial, viral, whatever. You want to use that more of the antifungals, antibacterial type of herbs. Your stomach pH is absolutely critical either way. If it's non-inflammatory, you're probably going to have an overgrowth of some type of bacteria or virus or fungus in the colon. If it's inflammatory, of course, you have too much acid. Test to diagnose and retest and see if it works. Bacterial dysbiosis, I'm going to go through this very, very quickly. Number one is treat the hypochlorhydria if it's present. You need that stomach acid barrier we talked about in the simple hypochlorhydria. Modified bowel cleanse plus antibacterial prescription, TID for 1 week, retest with your endocrine. Are you making progress? Is it 4? Did it drop to 2? Did it drop to 3? Show your patient. Let them see what's happening. Tell your patient if you have bacteria, they're going to bloat up when they do this. You start killing off bacteria and you start cleaning out the putrefaction, they're going to bloat up a little bit. Don't get too excited. Watch your neutrophil count, white blood cell count, see if it changes. CBCs are really cheap. Antibacterial products with bismuth is a good choice for bacteria. Try not to use it more than a couple of weeks. And also too, you want to make sure that your bismuth, tell your patients your stool is going to turn black. They may know enough to get really scared and think that they're bleeding inside. Make sure your herbal medicines are tested for metals and source your ingredients. Use quality products from quality companies. Use reputable companies who batch test for metals and ingredients. Check patient weekly for the first 3 weeks. You may have to change your herbals. And you're going to find this is the case with severe leaky gut. Their herbals will change weekly. They can actually become sensitive to the herbs too. So you want to be real flexible in that. Just that if it gets worse, they should improve quickly. 1 to 3 days is not unusual. I always tell the patients, it's going to take us a couple of weeks to get started, but I'm really thinking in my mind, 1 to 3 days, the patients should get better. They should feel much better. I don't have any documented data for this, but just my experience shows that B-complex vitamins, I take patients off of that with bacterial infections or chronic gut things. I don't know why, but it seems to give us trouble. I found this slide, I thought you might enjoy this. If you look at the little bulla on the back of the throat, I've found, just experienced that this indicates usually a viral infection of some sort. I use a product called Monolorn. I like this product. You got to start with large doses and then you titer down as you go. Tinctures are also effective with viral infections like olive leaf and other type of things that you guys are probably familiar with. Remember, dose your tinctures opposite of the bowel cleanse. And then, this is an excellent thing that I've seen over the years. Antifungal suggestions with your bowel cleanse. Citrus seed extract, berberine is a really good choice. Castor bean oil is an excellent choice. These are all good choices here. You can use them in combination with other things. On the this is the most difficult thing we do is fungus and candida. Do your modified bowel cleanse. Antifungal, minimum of 14 days with a fungal infection, usually 30, sometimes more, unless you're using diflucan. With diflucan, try to use it the minimum you can. Watch for rashes and the things that can happen with this stuff. And you're going to come back with something else. Reduce in week 2 to BID, but keep the antifungals at TID. Reduce the biodophilus and chlorophyll to 2 BID. Do not give biodophilus more than 1 month without retesting, especially with this. And often you're going to find acidophilus, biodophilus is not compatible with treating antifungals. So sometimes I don't even use it at all. Check the endocrine each week. It should correlate with the symptoms. You should get less bloating with your endocrine going down. Make sure you do your acid test. Reduce your grains, refined sugars for a minimum of 2 weeks. If you can do a glycemic index less than 90, with no more than grains at one time a day in these first 2 weeks, it makes your life a little easier than saying you can't have any grains at all. It's very difficult for people like this. They're going to be craving grains because the fungus makes them do that. Take them off the food sensitivities the first 6 weeks, retest, see what changes. It will. You should see positive change in 2 weeks. If not, it's time to change and do something different. If you have problems with bloating and upset stomach, have them come in and examine them. You might have to change the modified bowel cleanse or change the dosing on hydrochloric acid or pancreatic enzymes, or you may have to change the brand you're using. Be careful with Hersheimer's with fungal. This is the big one with fungus. Fuzzy headedness is the first symptom, or a rash. They come in and just say, I just don't feel right. I'm kind of foggy headed. You might be killing the fungus off too fast. Chronic gut infections are most difficult. Make sure you get your stomach pH. Advanced stool testing with this is going to be pretty important, particularly if you don't get results. If you don't get results, do your advanced stool testing, find out what you're dealing with in there. Be flexible and just according. No pain, no gain. And I've heard this before, you're going to get worse before you get better. It's not appropriate here. It's not appropriate in any gastrointestinal problem in the way that we do it. I want patients to get better with the treatment. If they start getting worse, we need to stop and evaluate. And with GI issues, that's just not the case. It's not the case with heavy metals necessarily, but with GI issues, you should see a steady improvement. Diarrhea from mild food poisoning, and you're going to see this so many times when you get involved with this work and you start doing gastro tests, endocrine, and this type of thing. You're going to have patients, it's usually your older patients, that come in. Like the day after I made this slide, I had this exact quote come in from one of my patients. I just ate something yesterday at a restaurant or the day before. A few hours later, I was bloated, didn't feel well, I got diarrhea. Remember, sometimes the chefs will cut a chicken before they wash it, and then they go cut the salad. Now you got bacteria floating around out there, and they have it under a light. And if they don't have a stomach acid barrier with hydrochloric acid, bingo, and they get an infection. But it's not bad enough to bring them to the hospital. Always do a urine analysis and in gastro test if you hadn't already had that on file. Epigastric is normally tender. If it's fever, you got to get into this a little deeper. Do a CBC at minimum. You'll have to make a judgment on if you want to continue or refer. If you're going to treat the patient, use a combination of the modified bowel cleanse and an antibacterial with bismuth, occasionally monolaurin, but the default would be berberis, some type of berberis with a bismuth or some combination, and you'll get very rapid results. When in doubt, use berberis. Schedule your patient for 2 days. At the least, you want to check and see where they're at. They should be improved. In fact, they should usually walk in and tell you, hey, I took that thing twice and I felt much better. These mild infections. And they'll improve very, very fast. Low stomach acid in these cases is sometimes the reason why they get sick. I just went over that with the knife and the chef. And the acid barrier is absent. Check that stomach pH. Patients without a gallbladder, and this is kind of just thrown in and do with modified bowel cleanse, but I thought it was very important. Give an ox bile supplement for life. If they don't have a gallbladder, they're not going to digest their fats. Without the fats, can't repair tissue. It's just a vicious cycle. Can't digest protein, can't digest minerals, can't digest your vitamins without hydrochloric acid, can't digest your fats without bile. Make sure they have bile. With inflammatory issues, use a combination with your ox bile that has nice soothing herbs that kind of calm things down at the same time. Dose with your HCl pepsin enzyme concurrently if indicated on your test. They can be taken together with meals. Don't forget to do the workup and testing. Here's what I'll tell you about if someone has stomach spasms, and this is just a nice little mix that we use. These are tinctures, and they can use as PRN. You can mix tinctures of turmeric, licorice, and artichoke, 33%. If that's with not a lot of spasm on that mix there. If it's a nervous stomach with spasm, wild yam, lemon balm. If these mixes here, 25 drops PRN. Bloating with spasm, wild yam, lemon balm, and licorice. And all of these are really nice. You can do it on an empty stomach between meals and just kind of settle things down. Don't forget your mucilaginous herbs. You can dose with this, but make sure you try to take them on an empty stomach. This will really give your patient something to kind of settle them down if they're having a lot of inflammatory issues. Okay, just some general thoughts. Modify the bowel cleanse by using different herbals and antibiotics if needed. If you have to use antibiotics, don't forget you got a lot of work to do after you get the infection under control. You'll find a great start to almost every chronically ill patient. I have a hard time thinking back over 3 decades of doing this, of any chronically ill patient that I didn't have on some sort of modified bowel cleanse. All starts with the gut. Used properly, and it'll correct a lot of complaints in the your first few weeks. Make sure you list all their complaints, and then about 2-3 weeks later they come in and they're happy, they're feeling good. Go through that list. How are your headaches? Oh, I forgot about the headaches. How's your low back? I forgot about the low backs. Acknowledge and find out what's correcting itself. It reduces inflammation for musculoskeletal patients. When I have this issue going on, I don't even adjust patients until after I get the inflammation reduced. And then, like on case number 1, if you notice, we just did 2 adjustments and the patient had 0 pain. Get rid of the inflammation from the gut issues and chronic inflammation, and your musculoskeletal patients will do very, very well. Some patients want to stay on for life, no problem. Just reduce the biodopsis and chlorophyll once a week initially, and then you want to stop it after a month. And then we talked about that in another, in number 1, but once a week, for 1 week out of each month, and a modified bowel cleanse with the herbals for a chronic gastrointestinal problem for up to 1 year, and that normally will normalize the stomach. Be sure to retest your patients at 3 and 6 months. Make sure they're back to normal. You can do it a whole lot faster than that, but make sure you do that. Then test every 12 months for life. And then every year, once your patients are stable, you call them in for their physical examination, a retest of the gastro test, retest of the blood work, and all the things that you're going to be doing. And you're going to manage this patient for life, and you make sure they don't fall off the wagon too bad, which they will do, as you well know. And you'll have lifetime patients. And it's a phenomenal referral base.